Welcome to Deep Dive Dialogue on Precision Oncology and Multi-Omics, Redefining Cancer Care in the Era of Personalized Medicine. Precision oncology, driven by multi-omics, is transforming cancer care by tailoring treatments to individual genetic profiles. Integrating genomics, transcriptomics, and proteomics enables more accurate diagnostics, personalized therapies, and better patient outcomes, making a transformative shift towards targeted, effective cancer treatment strategies. To discuss the topic, we are honored to welcome Dr. Anu, leading expert in precision oncology. As a research analyst in precision oncology at the University of Malta and a scientific expert and advisor in precision oncology and multi-omics at Guardant Health, she is at the forefront of advancing cancer research. Her work focuses on DNA damage repair, radiogenomics, and multi-omic data analysis to drive the development of precision medicine. Dr. Anu's contribution to innovative methodologies aim to transform cancer diagnostics and treatment, ensuring that her findings lead to meaningful clinical application in the fight against cancer. Welcome, Dr. Anu.
Thank you. Thank you for inviting me. It's a pleasure.
So, Dr. Anu, how can multi-omic approaches such as integrating genomics, transcriptomics, and proteomics redefine cancer care and improve clinical outcomes?
That I believe is a very, very important question. So, when you say multi-omics, at present, what everybody thinks of immediately is just genomics and transcriptomics. However, multi-omics encompasses a larger group of omics, starting from epigenomics, genomics, transcriptomics, proteomics, glycomics, lipidomics, immunomics, metabolomics, interactomics. So this is just a very brief section of the omes that we know, and there's much more that happens inside a cell and the related omics study part of it. We all know the central dogma and the sequence hypothesis, so this is oriented alongside the central dogma. Now, why do we really need a multi-omic approach? It is simply because no ome has like a standalone function in a disease. So there's this web of very dynamic interaction between all molecules and structures in a cell. So if we are just focusing on one variable or one ome, it actually undermines the entire functional network within a cell. And this is what happens in a healthy cell. So if you think about a cancer cell, it's much more complex. In fact, cellular machinery is quite focused on simply division, expansion, metastasis. There's an entire array of thermodynamic instability, to say so. So hence the need to combine or look into all omes, whatever we can, in one shot. When it comes to the clinical oncology timeline, we know that initially the cancer care started with surgery, followed by radiotherapy, followed by the invention of chemotherapy. Then came our mutation-specific targeted therapies, followed by immunotherapy. More variation targeted therapies at the moment are being discovered or developed. And yes, clinical endpoints for patients have definitely improved over millennia, to say so. However, we all know that there's still more to be done, more to be achieved. We're nowhere near elimination or curbing the silent epidemic. Hence, I believe it's a very important variable or factor to harness the power of multi-omics, which is going to help us in developing combined biomarkers. Biomarker selection and utility are always under debate. Differs from patient to patient, even if it is an approved marker. So a multi-omic approach will definitely help in better biomarkers. More importantly, in combining strategies of therapeutic modalities, in the sense, how can we combine maybe not just surgery, RT, for example, or it's more going to be like many different drugs that are going to target different parts of the O. So in that sense, this is going to be really helpful in these approaches are going to be very helpful in improving the clinical care.
Right. And I believe that so many biomarkers are emerging because of the follow multi-omic strategies.
Yes,
Right.
yes, exactly. Yes.
Okay. So my next question is that what are the most promising proteomic technologies for clinical use in cancer care?
Proteomics is very important. As a clinical biochemist, I believe in the importance and role of the proteome, which is by far, I guess, one of the most important if you put everything together, because the proteins are like the workhorses. So as of now, everybody knows we utilize biochemical assays, tumor markers, enzymes, which can assess oncoproteins, measure. We also use IHCs in the clinic, mass spectrometry for research purpose mainly. Everything is based on looking into the proteome. However, a large number of these assays look into the question of a qualitative or a quantitative. So is the protein present or not, or if present, how much of it? But in cancer, more than qualitative or quantitative, we actually have to understand the functional capacity of the protein, if that is maintained or not, if the protein is really functional. There are only less or very few number of assays that can do it. At present, hardly, I don't think we use much of it in the clinic. So presence of a protein does not warrant that it is functional. It can just be present as a non-functional protein or protein with lesser function. Hence, I believe it's very important that we look into the functional aspect. So there are many assays. Why, if you ask me, why aren't these in the clinic already? It's very hard for these assays to be standardized and used for a larger population quickly. The turnaround times are going to be longer. Standardization, harmonization is going to be difficult. So a lot of hurdles or roadblocks that way. Yet we still have to think about it. So there are functional enzymatic assays. There you can have these 3D cancer cell models and then see. So it's basically like how we say a genotype-phenotype correlation. It's along similar lines. So you need to see protein-protein interactions. If you can see, then you know, okay, the protein is doing its work. So that means it is functional and makes sense for being present there. Stability assays, ligand interaction assays, CRISPR knockouts. Those can also help in, there is this paper, it was just published yesterday, I think 2 papers along this line. They have looked into BRCA1 or 2 variants with CRISPR knockout assays to ascertain whether this is pathogenic or non-pathogenic in that sense. Also structure of the protein. So if you look at X-ray crystallography or NMR spec, you can really see if the entire structure is it that of a normal protein or an abnormal protein. Hence, we can derive data from and more information, relevant information from such assays. So these are not going to be in the clinic in the near future, but I believe it has to come in at one point.
So since you have touched genotype, so I would like to know that what are the most promising genomic technologies which are driving liquid biopsy, which is coming up in big way?
Liquid biopsy is still a very important topic everybody wants to discuss, and its pros and cons. So I always see this, especially on social media. It is a developing field, I must say that. And it's a field that has true potential, provided we know how to harness it properly. So we really need to understand the quality matrices of the assay, how well it can be replicated, stage of the disease when you are drawing the sample. Many factors. There are innumerable factors that work behind the success of liquid biopsy. At present, we know we have NGS that we use for assaying. We have the ddPCR, I know, is important. We could also, if you think in a futuristic sense, we could also try look at CTCs and utilize a single cell omic approach to understand in depth. I think it stops there as of now, because the challenge is in getting the yield and getting the profile as it is, reflecting the profile of the tumor or the metastatic tissue. So once we figure that out, and once that has been that's successful, then probably more and more technologies and is going to come up on the liquid biopsy platform.
Right. And since you have touched single cell, is also one of the technologies which is being used. So how do single cell RNA sequence and spatial transcriptomics enhance our understanding of tumor heterogeneity?
Tumor heterogeneity is a very vast topic. That's probably the one big hurdle that still gives everybody a run for their money, isn't it? That's probably the most challenging part of the disease, tumor heterogeneity. So to start with that, we have intratumoral, intertumoral, intermetastatic. So even if you're just looking at one patient with maybe a diagnosis of ovarian carcinoma, but it's the molecular profile inside the tissue is going to be so heterogeneous, isn't it? And today, when we look at a traditional biopsy, you're just looking at one window of a resected specimen, which is hardly the reflection of the entire tumor. Liquid biopsy, in that sense, I believe is like, it gives you like a broader snapshot of the entire tumor if done rightly. Single cell RNA-seq and spatial transcriptomics definitely can provide a very focused on this one section, can give you like a very focused in-depth view of what's happening inside. Now we know the reason for developing this, utilizing this, and one of the reasons for heterogeneity is there would be a founding clone, then the tumor would with time develop subclones. So it is logical to think that there would be different gene expression profiles along a single specimen. We could also find out, temporal dissection of variations. You would know the timeline if you look at this as a cross section. Now, as to come back to your question, I think it would be these two diagnostic technologies, if applied properly, would be very helpful for treatment selection and in case of drug resistance. So you get to see how the tumor microenvironment is, especially the immune microenvironment. I've seen, we've worked with samples of both using single cell RNA-seq or applying it in spatial transcriptomics. We've seen how well you can build the spatial tissue cellular architecture. It's crisp and clear. In that sense, you really know how much of, for example, if you're looking at an immune microenvironment, know how much of CD8 cells, how much of CD8 cells are there, how many macrophages are there, where they are placed. That's really, really important, I think, especially in terms of if you want to pick the correct drug or if you're looking at resistance. So I think both these technologies should be applied more. I know in a busy clinic it's not possible, but at least for understanding the disease, so that we have better options for patients tomorrow.
So from tumor microenvironment and resistance to, I would like to know that what are the challenges in integrating multi-omics data for actionable insights in oncology, since we have touched all.
Yeah. Of course, it is extremely challenging in many different aspects. That's probably one of the reasons it's still not prevalent in practice. To start with, you need huge infrastructure. You need all equipments, different kinds of assays, methodologies, a lot of things to even set up a laboratory that can focus on multi-omic reports. That automatically comes with a larger investment. There would be an imbalance there, and we'd have to invest a lot to develop, to create or design a lab with all multi-omic technologies. The practical one of the practical challenges would be time or turnaround time. That is going to be very long. So, which is something that isn't acceptable in the clinic. You want the patient's diagnosis or the prognostic implication as fast as possible, because many patients wait for treatment regimes to start with the report. So with a multi-omic analysis, it's going to take some time. You cannot give out a report in 2 weeks or 3 weeks. So that's there. Again, harmonization between labs. No two labs can get the same equipment, same assay, same. That's almost impossible. So reports from two different labs are going to be different. That's also a challenge. When it comes to interpretation, a multi-omic report can be generated from the data that's going to be generated from these technologies is going to be huge. It's not going to be 1 or 2 or 10. So you'll have to sift through a lot of data to reach a conclusion and give out a report. So it's humanly probably not possible to do so. Then you will have to rely on AI. We cannot completely rely on AI to generate reports. So there comes a point where is dimensionality reduction good here or not? Can it be applied directly to the clinic? These are the questions around the challenges. I'm not saying it's impossible, but we have to start thinking about how to make this possible, because this is the future. This is going to be the future. We will soon realize that without a multi-omic approach, we're not going to find an answer.
Right. With this note, I think I'll conclude. And I also believe that precision oncology and multi-omics are paving the way for personalized treatment, and by overcoming the hurdles and challenges, as you have said, that cost is a big factor, but we can definitely improve the cancer treatment. Thank you so much for joining us.
Thank you. Pleasure.